Welcome everyone to this briefing to launch the paper entitled A Multinational Delphi Consensus to End COVID-19 Public Health Threat. And that's to be published today online at 4 o'clock GMT in the scientific journal Nature. I'm Nancy Lee, a Program Director here at Wilton Park, an executive agency of the UK's Foreign and Commonwealth Office. We've had the pleasure of facilitating the Delphi Consensus meeting back in March of this year. And today it's a huge privilege for us to be able to mark this significant milestone with 3 of the 4 chairs of the expert panel who are in conversation with us today to talk a bit more about the paper. Congratulations to all the co-authors who've joined us online today for the launch. As we move into autumn here in the Northern Hemisphere, and it is indeed cold here in Sussex, COVID-19 restrictions are starting to ease around the world. However, at the same time, we're seeing lockdowns in China and a constant daily case numbers, which remind us that COVID-19 pandemic is far from over. COVID-19 and the emerging variants continue to threaten our lives and our livelihoods. So how do we collectively end COVID-19 as a public health threat? This is a question that this groundbreaking consensus study has aimed to address. So by gathering more than almost 400 multidisciplinary experts from 112 countries and territories who've consulted to develop this paper, it goes on to provide 41 consensus statements and 57 actionable recommendations to governments, health systems, industry, and other key stakeholders across 6 domains, which are communications, health systems, vaccination, prevention, treatment and care, and inequities. We have about 40 minutes today where we will speak in conversation with the 3 co-chairs of the expert panel. We'll hear a bit more about the process and methodology for the paper, the key recommendations, and who the intended audiences and aspirations are for both the reach and the impact of those recommendations. As I've noted, the paper is available online today from 4 o'clock. And we ask that you respect the media embargo. If you do have any questions, then please include those in the chat and we'll take those at the end. So I'd like to welcome to our panel today, Professor Jeff Lazarus, Head of the Health Systems Research Group at IS Global, an Associate Professor at the University of Barcelona, as well as a Senior Scholar at the CUNY Graduate School of Public Health and Health Policy. Professor Ayman El-Mohandes, Dean of School of the City University of New York and the Graduate School of Public Health and Health Policy. Professor Adiba Kumaruzulaman, Dean of Faculty of Medicine and Professor of Medicine and Infectious Diseases at the University of Malaya in Kuala Lumpur, Malaysia. Thank you for joining us late in your evening. Unable to join us today has been the 4th co-chair, Professor Agnes Benawahu, who's the Vice Chancellor of the University of Global Health Equity in Rwanda. So again, congratulations to all of you and the co-authors for a timely and much needed study. And I'd like to turn first to Professor Jeff Lazarus for introductory remarks, and also my first question as to what are the key recommendations for the study.
Well, thank you very much, Nancy, and thank you so much to Wilton Park for hosting this. Congratulations to everyone. This has been just such a monumental effort worthy of many, many thanks. And I would like to take the opportunity, having everyone online, to thank my 3 co-chairs, Ayman, Adiba, and Agnes, for this unprecedented effort to bring forward multinational recommendations to end the public health threat presented by COVID-19. I'd like to next thank our study's insightful and credible methodologist, Professor Diana Romero from the CUNY Graduate School of Public Health and Health Policy. It was heartening, exciting, and newspapers to say they read every word of the methods. They were just absolutely fascinated by this. They searched Nature and they hadn't seen that Nature had published an original research article using this methodology before. So we've helped, change the understanding of consensus methodologies as a scientific tool as well. I'd also like to thank, other key stakeholders in this effort, our editor, Mary Elizabeth Sutherland, and the editorial and publishing team, and the peer reviewers selected to work through our full task. That was no small task. Second, Wilton Park. So thanks again, Nancy, and for hosting that global online consent.
Well, I think we've lost Jeff there.
rounds and throughout the peer review and editorial processes to bring this article to fruition. This includes my close friend, Chris Kopka on the line, as well as Ken Robin here, also of CUNY, and three of my amazing IS Global team members, Trent White, Lena Van Selm, and Christina Pujol. Together, our panel of 386 people from 112 countries and territories have demonstrated that multidisciplinary, multinational coordination, while challenging, is possible. We've demonstrated that staying clear-eyed and level-headed in the middle of a politically unpopular pandemic is not only possible, but crucial. And we've demonstrated voluntary, nonpartisan efforts can address key areas of risk that decision makers must continue to confront and address. These 6 key areas. It's critically important that the consensus statements being published now and by Nature, a scientific journal not solely focused on health. We're at a time when many people, including political leaders, believe the pandemic is over or coming to an end, and yet variants of concern, infections, still high mortality, and the lottery-like specter of long COVID demonstrate in headlines as recently as this week that we have not ended COVID-19 as a public health threat. We sincerely hope decision makers throughout government, health systems, and industry will benefit from our work to end this threat. Most importantly, our top ranked recommendations must be implemented. So to answer your question, there are a whole of society and a whole of government approach, along with a vaccines plus approach, which means prevention measures that include and go beyond vaccination. We can do this, we should, and we must. So thank you very much again.
Thank you very much, Jeff. And we're sorry that we lost you a little bit in that introduction, but thank you for that. And I think very much and importantly, the note that consensus is possible in an emergency. So remembering that for ways of working going forward. And thank you for giving a very high overview of those recommendations that have come out of the study. I'm going to turn to Eamon and ask you, of those 6 high-level recommendations, which of those do you think are most important or resonate most with you, and why is that?
Well, thank you. I really do think that the area of communications is a very, very important area in this consensus endeavor. The effort to highlight the importance of communications in terms of community-based, culturally aware, collaborative efforts at communication, and being especially mindful of misinformation and the dangers that it has presented so far in people's understanding. Communications need to be transparent, need to be humble, need to be not simple meaning dumbed down, but simple meaning understandable and applicable to the widest audience. We need to enfranchise and collaborate with communities in selecting the medium of dissemination and the content of the communication messaging itself. Opinion leaders need to work with us as public health leaders in the best way to understand how we can reach the widest audience and demonstrate sensitivity in areas that have been frequently ignored. The next phase of communication around COVID needs to emphasize, as Jeff just said, that the pandemic is not over, but also emphasize approaches that include not just vaccination, but other efforts, and absolutely emphasize the importance of equity and the importance of personal choice with, at the same time, communal sense of responsibility. This is a very important element of this study, and we hope that it can guide policy, guide communication professionals, and improve the outcomes related to our ability to reach the widest audience. The next element of this study, you asked me to select 2, and the other one, I think Adiba and I would agree, is the area of equity. And equity, you know, immediately you think, I will let Adiba talk about one aspect of it, which is global equity. But I will talk about equity within our own populations, within our own communities, where we have seen COVID highlight inequities that are already pre-existing. Differences in mortality rates, differences in access to vaccine, and the lack of sensitivity towards economic priorities of disenfranchised and poorly resourced communities has caused a lag in our ability to confront this pandemic effectively. I find these two areas to be fascinating, and I'm particularly excited that the consensus reached such almost unanimous agreement about the importance of these areas. I hope that this is a call to action for governments, policymakers, and public health professionals. But dare I say, inequities are not only internal within our own countries, but they exist at a global level. And there, I think Adiba, with her incredible experience in the background history of HIV and how we dealt with it globally, it brings expertise and knowledge that few can bring to the table. And she championed this area where her interest and her advocacy are both extremely important.
Thank you very much, Ayman. So just reiterating for those you've joined us, of those 6 high-level recommendations, resonating with you most, Ayman, communications and the inequity piece. And I think that's a nice segue then to turn to Adiba around to contribute to that point around inequities coming from the Global South, your perspectives of what the calls to actions are around inequities from this paper. What are those actionable recommendations? Over to you. Thanks, Adiba.
Yeah, thank you, Nancy, and thank you, Ayman, for those kind words. I think really what this pandemic highlighted, as Ayman mentioned, is the inequities, not just globally, but also in-country inequities. And of course, the major highlight is that to this day, countries in low-income countries still, there are many people who have still not received the first dose of the vaccine. I think that's the most stark example of inequity. I think the recent WHO emergency pandemic meeting reported that overall all countries have reached 68% of first dose vaccination, but in low-income countries, it's still under a quarter of the population have received first at least 1 dose of vaccine. So that is a major gap that we're facing. And of course, the mantra that no one is safe until everybody is safe remains extremely relevant till today. And it is really sad that 2.5 years down, or close to 3 years down from the pandemic, that we have not learned, that we seem to be almost accepting that, every week we're hearing of new variants being reported, and yet we're not putting every effort we can to ensure that a good tool that we have, which is a vaccine, is given, not just the first dose, but the second and the boosters. When it comes to inequities, I think, of course, at the global level, you asked me, Nancy, what can be done. I think every effort is being taken to ensure that there's vaccine access to countries in low-income countries, but obviously much more needs to be done. But even when it's there in country, it seems that there's one thing to have the vaccine, but to actually have them in the arms of people. And this is where the emphasis on communication cannot be, overemphasized. If I could share my own experience here in Malaysia, where the inequities were in play at very early phases of the pandemic. We have a large number of migrant workers, and Malaysia took the decision to vaccinate everyone. But of course, reaching migrant workers from all parts of Asia needed to go to where they're at, meaning, providing language and information in language that, information and around the vaccines, assuring them of safety, etc., in language that they understand, which means working with the community. And I think that's the number one message of this consensus, isn't it? That it has to be a whole of society, whole of government response. And we saw that in action in the very early stages of the pandemic to try and overcome some of the inequities. Maybe I'll stop there. Mm-hmm.
Thank you, Adiba. And you have raised that, and very much one of the recommendations is a whole of society approach. So question to all of you, I'm going to start with Jeff this time, is given this whole of society approach from your perspective, and reflecting on the settings that you're working in, who are the key audiences? So we talk about a whole of society approach. Of that, who would you say the recommendations are targeting, and what is it important for those audiences to know? And the third bit of this question, what is actionable now? So effectively, what is actionable now and by whom?
Great. Well, thank you, Nancy. Yeah, so we stressed that whole of society approach, and that really targets health authorities, government leaders, but it targets them to engage the community, to engage both the general population and the marginalized populations. So for an example, in some countries like Spain, where I'm working, they reached almost, 85, 90% vaccination. But in some populations, it was under half. And so they weren't engaging with community leaders there. They weren't engaging with religious leaders there. And that's why we stressed so much in the paper, in the recommendations, on engagement with the community, on rebuilding trust, in working with trusted leaders in the community and among those religious leaders and others who can reach further than the authorities often can to reach them with prevention and treatment measures.
That's great. Thank you very much, Jeff. And Ayman, from your perspective?
Yeah, I would add to that, a whole society and whole government approach means a collaborative effort between education, industry, housing, transportation, public health, policymakers, and within government agencies themselves that frequently function in a very siloed manner. We need a better collaboration within governments, within agencies, within governments, to understand that this pandemic is not selective of health alone and has impacted people in their livelihood. And if we are going to be able to confront it together, there are many aspects, many of which are day-to-day living necessities and priorities, including food insecurity, including housing, including childcare, that have hampered the ability of many community members to respond to messaging that is public health focused, but does not provide them with the backup, provide them with the essentials of responding to our messages. So a whole society approach, I think, will enable us to overcome this hurdle and will help in regaining trust from communities that believe that some of these recommendations are simply not attainable for them as they confront their daily challenges.
Thank you, Ayman. A very, very big call there, I think, to engage with communities. Adiba, is there anything else you would like to add to that? Because you raised that community point to start off with, but in terms of what is actionable in the recommendations now and by whom, is there anything more you'd like to add?
Yeah, I just want to add, I think, we can see the world over that fatigue and complacency with the response has set in. And so I would hope that this paper would remind everyone, as we've been saying over and over again, that the pandemic is not over, and the call to action. And perhaps there also needs to be the next level of engagement with others that may not have seemed so urgent at the start, like the health system and community leaders. And here I want to specifically call out people who can look at an area which was somewhat neglected and still seems to be neglected, and that's ventilation. And there are many simple measures that can be taken, but we need authoritative voices from building engineers and architects and others to be part of the conversation, I think, because other areas, you know, in some ways, the public's sick of being told to wear your mask and, you know, socially distant and go and get your booster. But there are other aspects that perhaps we can re-emphasize and add to the core.
Thank you, Adiba, and very important again as we go into winter here, and we're all in stuffy rooms. So how do we make the most of ventilation going forward as well? So another question for all of you, given these recommendations, what do you hope will be the impact of this paper? Because it's really about now getting these recommendations out to the policymakers and seeing what the immediate and longer term impacts will be. So again, starting with you, Jeff, how do you think this study will make it possible to end COVID-19 as a public health crisis?
Well, this effort is really a call to action, as the co-chairs have been putting it. And that means paying attention to COVID-19 or the pandemic as a public health threat. So we hope that, you know, through the media now, through the publication in Nature, we'll have this renewed focus on that we're still in the pandemic. There's still much to do, but we have a set of actionable recommendations that can be taken at the higher level by governments and health systems authorities, but also many that are immediately actionable by a whole range of stakeholders, including at the community level. Like Adiba said, you know, improving ventilation at home, improving ventilation in schools, improving ventilation in places of work, you know, is possible, is immediately actionable. But the ask from above is guidance on how to do that even better. So each time we have these recommendations, it's for the bottom-up approach, but it's also, you know, for the top-down. You know, we really lack national strategies and we lack a global strategy. So what struck me throughout this process is I kept waiting for, you know, a global strategy to appear like we have for HIV or viral hepatitis or many NCDs, and yet that hasn't happened. So, you know, the big ask is that countries have comprehensive strategies and plans on what to do and when, especially as you said in your opening remarks, as we enter the winter season here and cases and hospitalizations start to go up.
Thank you, Jeff. So I think the impact there with supporting countries to develop those strategies and plans, it's really very much the bottom up and the top down approach.
Yes.
I mean, is there anything you would like to add to that?
Well, I just think that this consensus report is coming at a very crucial time where there could be malaise or fatigue from policymakers, from governments, or from communities. And this call to action hopefully will motivate, reactivate our interest in confronting the next phase of this pandemic. Furthermore, we believe that many of these principles are applicable to any future threats of a similar nature. You would have thought that we would have learned from previous experiences, but unfortunately, we haven't learned enough. And it is important for us to apply much of what this consensus is contributing towards long-term approaches to similar threats.
Very important point of approaching of this being preparedness and resilience. Adiba, Jeff just mentioned that what he was surprised about through this process was expecting to see guidance come and it didn't. For you, both in terms of the outcomes of the study, what was the most surprising piece for you in terms of, perhaps it wasn't anything that was surprising, but in terms of the outcomes and what you found in the study, was there anything that was of particular surprisingly for you?
Not so much from the outcome, but in terms of how we managed to, you know, get more than close to 400 people from different backgrounds and professional backgrounds, as well as, you know, a whole range of high and low income countries to virtually, as Eamon said, come to a unanimous consensus on the recommendations that were put forward. So I think that is something that we're all very proud of, and everyone, particularly Jeff and his team at IC and the team at CUNY worked so hard with very little cost and really made use of the power of the internet and our interconnectivity. And just one last thing I want to say about the point about the consensus is what we're asking. If you look at the recommendations, it's nothing, you know, in a way that's new or earth-shattering, but it really is putting together what we have learned from the last 2.5, 3 years and doing it effectively, which I think many countries are still not doing.
I would just add to
Indeed.
that, if I may, Nancy, because I agree with Adiba's last point. So, you know, I wanted to correct, there has been a lot of technical guidance. There have been a lot of recommendations. So it's not really that's been lacking. It's just, it hasn't been in one place. It hasn't been part of an overall strategy, both at the country levels, regional and national, or sorry, and global levels. And I just wanted to mention, you know, one of our concrete recommendations, recommendation 6.1, and I'll just read it quickly because it's so important. It's recognizing that local and regional contexts are important for equitable responses to the pandemics. Governments should engage communities and multidisciplinary experts who understand the local context when developing operational plans for ending COVID-19 as a public health threat. So what we did when we started as a small group and expanded to 40 core authors was then expand that up to almost 400 so that we really could understand different contexts and make sure that recommendations were relevant all over the world, recommendations that are actionable, that have teeth, that are important and that can make change, but that can also receive a high level of consensus so that we could ultimately agree on them and recommend them.
Thank you, Jeff. Because I wonder if you would like to say more about in terms of going forward. You know, I think this is almost a watershed moment in terms of the consensus that you got and the multidisciplinary approach that was taken. Would you like to comment a bit around the areas where there wasn't consensus? But I think more broadly, what this process has shown us for how we can work collectively and collaboratively going forward.
Yeah, I mean, that's exactly right. I think you know, a process like this can be done really in every country, and that means engaging not just epidemiologists and infectious disease specialists. I count myself, you know, among that group, but also anthropologists, political scientists, sociologists, lawyers, philosophers, people who understand society, bring them together. And like you said, in this kind of process, we also report the amount of disagreement. There were very low levels of disagreement, but on a few recommendations, a few statements, you know, there was over 5% disagreement. And it's important to recognize that, to work through it, to understand why, you know, experts would disagree with a particular recommendation, for example, around economic incentives. And we understand that that's because some people felt it wouldn't be realistic in their country. Others thought that there are other problems with economic incentives. But the core recommendations, the vast majority, have a near unanimous, a very high level of consensus. And I'd encourage governments and others to adapt a Delphi methodology or something similar to take really a whole of society approach, but also this kind of consensus methodology that allows for disagreement, because so many of the recommendations that are issued now, we don't know where there was disagreement. And if we don't know that, it's going to make it challenging to implement, because we don't know why people disagree with us, with the entire recommendation or a small part of it. And that's what makes this a bit unique. I'm sorry, Ayman, I think I started to cut you off. Apologies.
Come in, Ayman. Thank you.
Not at all. I just saw a question on our chat from Rodrigo Quiroga, and he says, an outstanding phrase from a panel member yesterday was, a major factor in pandemic fatigue is probably that many governments are now putting the entire weight of the pandemic on the shoulders of individuals. And do the chairs agree? And I really think that governments, like individuals, can be distracted by so many priorities. We're in a stage of history where there's a war going on, continued immigrant and migrant crises, economic issues, ongoing elections. So governments need a reminder, and this effort in of itself, 400 experts putting of their time in an unfunded effort the priority of creating a consensus such as this is perhaps an incentive for governments to prioritize these issues and understand that a very large global group of experts agree that actions are needed and that the pandemic is not over. So governments, like individuals, need reminders and need the incentive to prioritize areas of intervention when they themselves are mired in a whole lot of other distractions and other conflicting priorities. I just needed to say that.
Thank you very much, Hyman. Adiba, you also raised the point about pandemic fatigue. Is there anything else you would like to contribute to that question?
No, I think Eamon addressed it very well. Thank you.
Great, thank you very much. I'm just going to go back to Ayman before we then go to other questions in the chat. Ayman, the question I'd asked Adiba is what has come out of this study that may have surprised you in terms of the outcomes or the process?
Actually, what surprised me most was the level of consensus, was the level of agreement of 400 people, more than 100,000 hours of effort. And people came together around a set of priorities and felt very strongly about them. So there must be some truth to this, you know what I mean? It's not that easy to discount this effort as, you know, oh, yet another paper. This is truly a call to action and hopefully will be taken and disseminated and used wisely and seriously. But what surprised me most was that 85% at least of respondents went phase after phase. This is a triphasic process and committed themselves to continue the Delphi process so that the study, the effort can stand and can be credible. That was very surprising to me.
Indeed. Thank you very much. I'm going to start taking some questions in our chat now. So a question from Valeria in Argentina to all of the chairs. Whoops, I just try and get it back again. What should be done? Sorry, I'm just struggling slightly.
What should be done to address equity?
Equity, there we go. Jeff, would you like to start off?
I sent some comments back in the chat and I'd really love, of course, you know, Adiba and Ayman to weigh in because there's so much. I mean, equity is the cornerstone of public health. It's the cornerstone of the WHO Constitution. It's listening to marginalized voices. It's identifying where there is an inequitable situation. It can be among countries like we saw with vaccination, with low-income countries not getting access to the vaccines. And it's also within countries. So it's not that things are perfect in the high income countries. The most marginalized populations, many migrant populations, people who use drugs, the homeless, different ethnic minorities have suffered worse, have had less access to health systems. So it's about addressing those populations. So in Argentina, where Valeria works, it also means the Mapuche population. It means addressing the Araucanos. It means addressing the poorest of the poor and making sure that, you know, there aren't high opportunity costs to get care, to get vaccinated, that they're compensated if they lose time at work because they have to stay home with COVID-19, which is a benefit, which is a societal benefit because they're not transmitting it to others. So the equity question is always a big one, but it's really come to a fore during the pandemic. And we've seen that pandemic inequities is also what's driving the continuation of the pandemic. Thanks.
Indeed. Thanks, Jeff. And Adiba, we have heard from you on the inequity piece. Ayman, is there anything else you would like to add to that?
I just need to emphasize that equity and equality are not the same. So delivering something in equal measure to all people doesn't work. And equity means being insightful into the scenario, the life scenario, the priorities and the obstacles of a particular group of people. And I don't want to only emphasize poverty as an obstacle. Life circumstances can also be obstacles. A young working couple with 3 children in the home may need childcare and may need a system that allows the working partner or both of them working not to go to work today, to prioritize an intervention such as vaccination. and to understand that sometimes a day after vaccines, people don't feel that well. So equity here means understanding the priorities and the specificities of the needs of segments of the population and responding to them respectfully, without necessarily making them feel like they're not performing their role in a societal initiative, but rather making it easier for them to participate.
Thank you very much. I have one other question from the floor regarding the impacts of long COVID, which I'd like each of you to respond to. And we've got about 7 minutes left, and then one final wrap-up remark from each of you. So it's really a question about the increasing concern about the impact of long COVID. What is the relevance of the recommendations for tackling the long-term burden of COVID? So who would like to start off on that question? So what is the relevance of the recommendations for tackling the long-term burden of COVID, considering the impact of long-term COVID? Adiba, would you like to start?
Yeah, I guess this is why there is this call to action, you know, to end COVID-19 as a public health threat, that we want to see the incidence of COVID-19 be reduced, because, you know, there's still so much that we don't understand about long COVID. And, you know, from what we know, the risk of it is not insubstantial, both in terms of the possibility of contracting long COVID, and also the spectrum of diseases that make up long COVID. So in a way, it's imperative that governments and individuals ensure that we bring this COVID-19 to an end, so that we don't repeat what we saw with HIV/AIDS in terms of the long-term complications of the disease.
Indeed.
Yeah.
Thank you very much.
You know,
Jeff?
long COVID is like the next pandemic, already in the middle of this pandemic, and it's amazing how under-recognized it is. And that's why the statements, you know, clearly set out that we need to recognize long COVID. The recommendations call for clear definitions, because this is going to be an issue of reimbursements in the health system, of time lost at work. So we need to recognize that this is a real disease with real characteristics. And I don't know if anyone on the panel or Nancy, you'd like to comment on this, but, you know, long COVID is not something that just affects the elderly. We've seen a very surprisingly high prevalence among children, but also among young people. And you know, we're you know, there's different estimates, but is it, you know, is it 6%? Is it 12%? It's not being tracked well. It's not being taken seriously. And for everyone who has it, it's a incredibly serious, long-term, ongoing issue. And our recommendations strongly urge governments to take this seriously for so many reasons, both health reasons, societal reasons, and also economic reasons. Nancy?
Thank you, Jeff. And anecdotally and from a personal perspective, under 50, triple jabbed, fairly healthy, significant long COVID, and actually a significant stint in hospital. So, you know, certainly from my perspective, and I think it was a wake-up call for a number of my friends, that this is not just something that happens to people who are old, infirmed, or otherwise have comorbidities. So again, you know, from a personal message of the importance of these recommendations. Ayman, any additional thoughts on long COVID?
I think that also plays an important role in us combating misinformation. For misinformation to say that the risks of the vaccine outweigh the risks of the disease itself is so misinformed. And I think long COVID, as a consequence, needs to be better understood as one of the many manifestations that can impact on people's lives long term, and is an important aspect of the risk of exposure to COVID. So just to say, you know, with the vaccine, you may have 1 or 2 days of illness and then you're back to normal, is simply not accurate.
Well, like you said, Nancy, I mean, triple jabbed, healthy lifestyle, and a very serious bout of long COVID. I mean, people on the call need to be aware. I mean, that was a long hospital stay, and we were incredibly worried. And that's why our recommendation on the vaccines plus approach is so important, because vaccines alone don't always work. They work incredibly well. They're incredibly effective, but they're not 100%, as we saw in your case, but as we've seen in the case of tens of millions of people around the world.
Indeed, and that is why also, the point you've raised, Jeff, around health systems, is also important. So improving health systems wherever we can, so that more people have a better chance of recovery and survival. So my last question to each of you, given this very comprehensive study, and again, congratulations to all of you and to those co-authors who are online joining us today, is what is your one key take-home message? And I know there's probably a number, but if you could choose one take-home message, what would it be? So I'm going to start with Adiba. Oops, you're on mute there.
Yeah, I think that the pandemic is not over, and it really requires a whole government, a whole society approach for us to beat this disease.
Thank you, Adiba. A whole of society approach, and it's not over. Ayman, to you, what's your one key take-home message?
It's never too late to regain trust. Trust may have been lost, but it can be regained with the right approach, with a collaborative, respectful, community-based approach. Trust can be regained. Really
important message. Thank you very much, Ayman. And Jeff, finally to you, your key take-home from the study.
Yeah, well, dovetailing on what Ayman said, our study also has statements and recommendations to restore trust and emphasize evidence-based scientific decision-making. But my main take-home message is that global collaboration is possible, and this effort shows that. Almost 400 people from 112 countries on a very low budget. Most of us didn't know each other. We've been working, as Ayman said, on a volunteer basis for over a year to bring this forward. So the main message is really more collaboration, transparent collaboration involving everyone from low, middle, and high-income countries, but also marginalized populations, the community, and a whole range of experts.
Thank you very much, Jeff. A really important message. Collaboration is possible, and it's possible to collaborate even without agreeing on every single point, but or more importantly, to hear what it is that we don't necessarily all agree on. But on that note, a huge congratulations to you all. COVID is not over. There is the opportunity to collaborate. It must be a whole of government approach. So thank you all for joining today. Thank you to our panel, to all of the co-authors who've also joined, and others of you who've joined today. This recording will be available online. A reminder that the paper will go live online at Nature at 4 o'clock Greenwich Mean Time today, and will be available in print on the 10th of November. Should you wish to contact the co-chairs, their details are in the chat. I'm sure they're more than happy to answer any other questions you have with regard to the paper. So thanks all, and enjoy the rest of your day. Again, a huge congratulations to all of you on a monumental effort. Thanks for joining.